I think one of the light bulb moments that I had was just when I was all by myself as a student and I found a liver tumor. In that moment, I realized I was the only person that really knew that this existed in the patient. It's a very rewarding experience to know that that hard work is paying off and that you actually made a legitimate difference in that patient's life. Sonography was especially appealing to me because I knew that I was really interested in medical imaging, but specifically sonography, there's just so much critical thinking that has to go into everything that we do, and I kind of liken it to us being detectives, and we are searching for a reason for the patient's symptom. So pretty much from day one, we'll have our introductory lecture in the morning, and then in the afternoon you go downstairs into the sonography lab and you get to work with the ultrasound machines, and you scan your fellow classmates, their abdominal organs, and you're learning what different organs are, how to lay them out, and start the process of really trying to understand how to take diagnostic and quality images. So the relationship with my classmates is one of my favorite parts of the sonography program that I experienced. We were all really tight-knit. Class sizes are small, and so it gives us an opportunity to really bond, and we are able to ask each other questions and learn from each other as we're struggling through different concepts, or you just need somebody to practice with in lab. They're always willing to help, and it gives you a really good foundation of people there to support you. So the sonography program also has the lectures, the lab, and the clinicals, and it's really unique because a lot of other programs you aren't in clinicals until your second year, but it's just after a couple weeks you're involved in clinicals here, and so the students get a really, really hands-on experience right when they start out. It's the connection with the patient. That's why most of us go into healthcare, is because we want to help our patients. We just play a really important role in the patient's care, and I loved interacting with patients, so this is a great way to be hands-on and be able to spend some time with the patients too. There's so many opportunities here that really makes me want to stay for a long time.